Hey everyone, it's Aaron and welcome back to my channel. Today we're diving deep into the world of blood pressure, a topic that's super important for your overall health. You see, blood pressure is the force your blood exerts on your artery walls as your heart pumps it throughout your body. This pressure is vital for life, but when it's too high or too low, it can lead to some serious health problems. Now, many people focus on high blood pressure, and rightfully so, but did you know that low blood pressure can also be a concern? That's why in this video, we'll be exploring practical, natural ways to lower high blood pressure, and we'll also shed light on the causes and implications of low blood pressure. Whether you're dealing with blood pressure concerns yourself or simply want to be proactive about your health, this video has something for you, so make sure you stick around until the very end. Trust me, your heart will thank you. Let's kick things off with everyone's favorite topic, exercise. Okay, maybe not everyone's favorite, but trust me on this one. When you exercise regularly, you're essentially giving your heart a workout too. It's like hitting the gym for your cardiovascular system. Regular physical activity strengthens your heart muscle, making it a more efficient pump. This increased efficiency means your heart doesn't have to work as hard to circulate blood, which in turn lowers the pressure on your arteries. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And remember, it doesn't have to be anything crazy. A brisk walk, a jog around the park, swimming, cycling, or even dancing around your living room. Find something you enjoy and get moving. We are what we eat, right? Well, that holds true for our blood pressure too. A healthy diet is the cornerstone of healthy blood pressure management. And no, I'm not talking about bland, restrictive diets. I'm talking about delicious whole foods that nourish your body from the inside out. Load up on fruits, vegetables, whole grains, and lean protein. These foods are naturally lower in sodium and rich in potassium, two minerals that play a key role in regulating blood pressure. And speaking of sodium, try to keep your intake below 2,300 milligrams per day, even less if you're already dealing with hypertension. Let's face it, we live in a stressful world. Deadlines, responsibilities, and the constant pressure to do it all can take a toll on our mental and physical health, including our blood pressure. When we're stressed, our bodies go into fight or flight mode, releasing hormones like adrenaline that cause our blood pressure to spike. Now, we can't completely eliminate stress from our lives, but we can learn to manage it better. Incorporate stress-reducing techniques into your daily routine, such as mindfulness meditation, deep breathing exercises, or yoga. Even something as simple as spending time in nature can work wonders for your stress levels and your blood pressure. Now, let's talk about weight management. And no, this isn't about fitting into a certain size or achieving a specific number on the scale. It's about prioritizing your health and well-being. Carrying excess weight puts extra strain on your heart and arteries. It's like asking your heart to work overtime day in and day out. By losing even a small amount of weight, you can significantly reduce this burden on your cardiovascular system. And the best part, it doesn't require any drastic measures. Focus on making sustainable lifestyle changes, such as incorporating regular exercise and a balanced diet, the same principles we discussed earlier. All right, let's address the elephants in the room, alcohol and smoking. We all know they're bad for us, but did you know they can wreak havoc on our blood pressure too? Excessive alcohol consumption can lead to a temporary spike in blood pressure, and over time, it can contribute to long-term hypertension. And smoking, well, it's public enemy number one for your blood vessels. Smoking damages the lining of your arteries, making them narrower and stiffer, which forces your heart to work harder to pump blood, ultimately raising your blood pressure. So if you're serious about managing your blood pressure, it's time to ditch these habits for good. Now let's shift gears a bit and talk about low blood pressure, also known as hypertension. You might be thinking low blood pressure. Isn't high blood pressure the real villain? And while it's true that high blood pressure is a major health concern, low blood pressure can also lead to problems. One of the most common causes of low blood pressure is dehydration. When your body loses more fluids than it takes in, it can lead to a decrease in blood volume. And less blood volume means less pressure on your artery walls, resulting in low blood pressure. Chapter 7: Nutritional Deficiencies and Blood Pressure. We all know that a balanced diet is crucial for overall health, but did you know that certain nutritional deficiencies can also impact your blood pressure? That's right, folks, what you eat or don't eat can play a role in hypertension. For example, low levels of vitamin B12, folate, or iron can impair your body's ability to produce enough red blood cells, leading to a condition called anemia. Anemia, in turn, can cause low blood pressure because there's simply not enough healthy red blood cells to carry oxygen throughout your body. Chapter 8: Heart Problems, when the pump needs a tune-up. Now let's talk about the heart of the matter. Literally, when your heart isn't functioning optimally, it can lead to a whole host of problems, including low blood pressure. Conditions like bradycardia, which is a slow heart rate, heart valve issues, or heart failure can all impact your heart's ability to pump blood effectively. When your heart can't pump blood efficiently, it can't maintain adequate blood pressure, which can lead to fatigue, dizziness, and even fainting. Chapter 9: Endocrine Disorders, Hormonal Imbalances, and Blood Pressure. Our endocrine system, the intricate network of glands that produce and regulate hormones, plays a crucial role in maintaining our body's delicate balance. But when this system is thrown out of whack, it can have far-reaching effects, including on our blood pressure. Conditions like adrenal insufficiency, where your adrenal glands don't produce enough cortisol, or hypothyroidism, an underactive thyroid gland, can disrupt the production of hormones that regulate blood pressure. This one might seem obvious, but it's important to understand the connection between blood loss and low blood pressure. When we experience significant blood loss, whether from trauma, surgery, or internal bleeding, our blood volume decreases. As you now know, blood volume and blood pressure go hand in hand. When blood volume drops, so does blood pressure. This is why it's crucial to address the source of bleeding promptly and replenish blood volume through fluids, or in severe cases, transfusions. Let's talk about a serious medical condition that can lead to dangerously low blood pressure: sepsis. Sepsis occurs when an infection spreads throughout the body, triggering a chain reaction that can damage organs and lead to septic shock. During septic shock, blood pressure plummets to dangerously low levels, making it a life-threatening emergency. Immediate medical intervention, including antibiotics and intravenous fluids, is crucial to stabilize the patient and increase their chances of survival. Medications are often lifesavers, helping us manage a wide range of health conditions. But like any intervention, medications can sometimes come with side effects, and one of those side effects can be low blood pressure. Certain medications, including diuretics, beta blockers, antidepressants, and even some medications for Parkinson's disease, can lower blood pressure. If you suspect that your medication is causing low blood pressure, don't stop taking it abruptly. Instead, consult with your doctor. So, there you have it, a comprehensive look at blood pressure, from natural ways to lower high blood pressure to the often overlooked causes of low blood pressure. Remember, managing your blood pressure is crucial for maintaining your cardiovascular health and overall well-being. If you're concerned about your blood pressure, whether it's too high or too low, don't hesitate to reach out to your healthcare provider. They can assess your individual situation, provide personalized advice, and recommend the best course of action. And as always, make sure you're subscribed to my channel for more informative videos on health, wellness, and everything in between. Until next time, stay healthy, stay informed, and take care of yourselves.